NATO chief Mark Rutte there, speaking alongside the French President Emmanuel Macron a few moments ago. Just coming up to 20 to 1 in the afternoon, let's talk about a once-a-day stop smoking pill, which will now be offered to tens of thousands of people on the NHS in England. Varenicline will be more effective than nicotine replacement gum or patches and is as effective as vapes in helping people to quit. University College London estimates it could prevent up to 9,500 smoking-related deaths over the course of the next 5 years. Sanjay Agrawal from NHS England said the pill would be a game-changer for people looking to stop smoking.
It's a great drug, actually. It's really effective. We know that it helps around 1 in 4 people quit smoking together with behavioural support. It has been around for a long time, and it's really clever the way it works. It makes people not feel like they want to smoke. It reduces this craving for smoking and for nicotine, as well as reducing the side effects from nicotine withdrawal. So it's brilliant. It's really effective. The good news is it's going to be really cheap as well. So it's incredibly cheap, cheaper than the version that was previously available. So I think it will be a real game changer for people who want to quit. And we know that the vast majority of people who smoke actually want to quit, and about a third of people who smoke make a quit attempt each year. And we know that around 1 in 8 people in the UK smoke. We know that it causes cancers, heart disease. It takes people's lives away, and it leads to long-term ill health. So the NHS and society in the country have made a renewed effort to really stop our kids from ever smoking, and that's from the tobacco and vapes bill that we heard about much more last week, but also to help the 6 million people who currently smoke to quit. And this tablet will make a really big difference. It's estimated that over the next 5 years, around 10,000 people will quit as a result of the reintroduction of this medicine. So it's great news.
Well, we're joined now by Caitlin Nichols, Professor of Addiction Studies at the University of East Anglia. Really appreciate you making time for us this afternoon. As was just said previously in that clip we played, this pill's been around once before but was taken out of use. It's back now. What's changed? What's different?
That's right. Well, Varenicline, which is the active ingredient, was taken off the market in the UK in 2021, then under the brand name of Champix. There were concerns at the time about potential impurities within the medication, so it was taken off the market for safety reasons. It has now been reapproved under different brand names, and the new version is thought to be safe. We know that Varenicline is a very effective treatment for smoking cessation. At the time in 2021, it was estimated that about 4% of people who smoked who were trying to quit would use Varenicline as a way of supporting their quit attempt. It's incredibly effective. It works in a really clever way. It's what we call a nicotine agonist. So it stops the brain actually wanting nicotine. It takes away the feelings of craving for nicotine. So people taking the drug find that they're not actually craving smoking anymore. In fact, they feel quite disgusted at the idea of smoking. So it works in a really remarkable way. And it's estimated, that it could save many thousands of people's lives every year as a result of quitting smoking. So it's a really important treatment approach. It is only going to be available on prescription. So, it's particularly helpful for those people who are seeking support to quit smoking, and particularly able to talk to their GP or to a stop smoking service and receive that prescription. And especially effective if used alongside structured behavioural support at the same time.
So using it alongside, like, say, behavioural support, you wouldn't need to use it then alongside a nicotine patch as well, for example, because the two would almost be in conflict with each other?
That's right, because the drug acts in a way that takes away the cravings for nicotine, and people actually find that they're not wanting to use nicotine replacement products either, as well as wanting to stop smoking. So it's an alternative approach. And really important, I think, for people that smoke is to have these different alternatives. You know, for some people, this approach is going to be the best way to stop smoking completely. Other people may not want to stop using nicotine or may find that they're not able to. For those people, equally effective forms of treatment could be a nicotine-containing e-cigarette, or other drugs potentially. So cytosine is another medication that is going to be available on prescription in the UK. Has been available in other countries, not in the UK, but that will also be available on prescription. So having these different treatment options, I think, is the most important thing. We know that tobacco smoking, is uniquely deadly. It's the only health behaviour that is likely to kill about half of people that actually engage with it. So the more options we have to support people who smoke tobacco to quit, the better it is for the public.
1 in 8 adults in the UK who smoke, 400,000 or so hospital admissions each year resultant of smoking-related illnesses. Is this new pill going to be targeted solely at people who smoke tobacco, or do we expect to see some prescriptions made for people who are now increasingly reliant on vapes as well?
Potentially, it might be an option for people who have a nicotine addiction, have been using nicotine in other ways, for example, through vaping. There are trials underway looking at these stop smoking medications for people who vape nicotine. And potentially, it is an option. It acts in the same way. It would stop the cravings for nicotine. So it could work equally as effectively for people that want to quit nicotine vaping. Yes. But really important to remember that nicotine vaping itself is an effective smoking cessation intervention. And for some people, that's the best option, switching to using nicotine in a less harmful way. And then it might be that further down the line, they want to try one of these medications to think about moving away from nicotine completely.
Talk to us, if you will, about the concept of addiction itself, because many non-smokers, I'm sure, have just looked at someone who does smoke, who says they want to stop, and say, well, just put the cigarettes down, just don't smoke. But it's not that easy, is it? And drugs such as this do open the door to people who have really struggled in the past to break that cycle of addiction. Yeah.
That's right. I mean, I think, dependence on smoking addiction particularly, is an incredibly powerful addiction. Most smokers, first try smoking tobacco during childhood at a time when they're very vulnerable. They perhaps go on and develop a nicotine addiction. And it's a really powerful addiction that's very difficult to move away from. If you try to quit smoking cold turkey, just by stopping, just by putting that cigarette out, you will experience very unpleasant withdrawal side effects, make it really difficult to stay smoke-free. There's also other aspects of tobacco smoking that smokers find it really difficult to move away from. There's not only the nicotine addiction, but the sort of social and cultural elements of tobacco smoking. So the really positive thing now that we have the tobacco and vapes bill is that we are starting to see the reality of what a smoke-free generation might be like, where smoking is less normative as a cultural and social phenomenon, and that might make it easier for people to move away from tobacco smoking because they just won't be surrounded by it so much. But nonetheless, just being dependent on nicotine itself is really, really powerful. It is an addiction which we should see in a medical way. So offering people treatment through the NHS to deal with that addiction is going to be really effective in helping them to quit.
Joining us from Norwich, Professor Caitlin Nichols, really appreciate your insights. Thank you.